My name is Dr. Katharina Richter. I'm a scientist and Superbug slayer. That means my goal is to defeat antibiotic-resistant bacteria. Superbugs are a major threat to human health. Currently, there are about 700,000 people dying every year from a superbug infection, and this is predicted to rise to 10 million deaths per year by the year 2050 if we don't come up with new strategies how to defeat superbugs. So best medical care heavily relies on antibiotics, and there are not really a lot of alternatives out there. So that means when bacteria became resistant to antibiotics, and we only treat them with antibiotics, of course, the infection is not going to be cured. And that means in return for the patient, they have ongoing symptoms, they have ongoing disease, they are suffering a lot, they have a very low quality of life. And this all really impacts not only the patient itself, but also the whole family, the entire community, and even at work, of course. The new treatments I develop don't rely on antibiotics. Instead, they actually have a different mechanism of action. So we are defeating superbugs in a different way to antibiotics. That means we could even kill resistant superbugs. And my treatments typically use multiple approaches, like from different angles, how we can truly tackle those superbugs. The health outcome for patients is that they have a more effective treatment. That means they get better sooner. They will hopefully not have continuous disease. That means they are healthier and happier. They can have their normal life back and a great quality of life. Because my treatments are not based on antibiotics, we also have less risk to develop resistance in bacteria. That means we could have these kind of treatments not only right now, but hopefully for the long future. If my treatments work in the long term, that also means that patients don't need to come that often back to the hospital. That means it saves a lot of time for them and it saves a lot of money for the healthcare.